My name is Dylan Nagalski, and I'm here to speak to you today from GE Healthcare about the Global Commercial Leadership Program and the Commercial Leadership Program Internship. And just a little background. So I am based in Phoenix, Arizona here. I am an account manager for perioperative and respiratory care. I've been with GE Healthcare for 6 years. I'm based in Phoenix, Arizona. And I actually went through this commercial leadership program myself. So I'm very, very passionate about it. And that's mainly what I want to talk to you about today, is how great of an experience it was and how life-changing it was for me as a recent graduate right out of college. I have recruited at U of A in the past, and over the past couple of years, we've had some success with U of A graduates going into this commercial leadership program. And I attended the University of Wisconsin-La Crosse, studied healthcare information systems and marketing. And there's my contact info, and I'll make sure you all have this following the presentation as well. So as with the other two companies that presented today, another big household name. So at GE, we help solve some of the world's biggest problems. We're a global company with over 200,000 employees. We are all over the world in over 180 countries, and we've been around for over 125 years. Back when Thomas Edison founded the company, it started with the light bulb and that big invention, or helping make the Industrial Revolution and making power grids. But now it's all about cleaner, more reliable energy, safer transportation, and more importantly, in the space that I'm in, more accessible and safer healthcare. So at GE currently, we have 4 core businesses. That's going to be GE Aviation with more than 64,000 aircraft engines worldwide. Then we have GE Renewable Energy, which is our sustainability business, and our GE Healthcare, which is a business that I'm going to talk to you about today, and then GE Gas and Power. So GE Healthcare, everybody that works at this company has an extreme passion for healthcare and improving lives in the moments that matter. Everybody can probably think of somebody in their lives, a family member, a dear friend who has gone through something, a health challenge. And at one point in time during that challenge or journey, they probably experienced GE Healthcare medical technology. And this really became extremely relevant, especially to me during the COVID-19 pandemic. Being in anesthesia and respiratory care, this was really when I realized how important the work that GE Healthcare does. So as you can probably remember, during the peak of the pandemic, there was an extreme shortage for ICU ventilators as more and more patients were being admitted to ICUs. And myself, I am directly responsible for the sales of ICU ventilators in Arizona and New Mexico. And so, of course, my phone was ringing nonstop, and I couldn't do anything. I mean, we had extremely long lead times. The business was challenged. Our supply chain was challenged. Nobody really understood what was going on. It was a true pandemic, both nationally and just internally at the company. It was chaos. And that's when I saw GE Healthcare step up, and we partnered with Ford, the automotive company, and we developed a ventilator and partnered with the government, and every ventilator that was coming out of our factory went straight to the government and were being distributed nationally to hotspots across the country. So it was just really impactful to see, in a true panic and pandemic, the company step up, partner with the government, partner with another giant corporation in the United States to improve lives again in the moment that mattered. And then also, as you may have seen in recent news, GE Healthcare will actually be its own individual company in 2023. So it's a very exciting time to be joining GE, because historically we are a part of the General Electric umbrella, meaning we were with GE Aviation, GE Power, GE Renewable Energy. But now GE Healthcare will be spun off and we will be one of the largest independent healthcare medical equipment providers in the world. And it's really great for us because we no longer have to report under the bureaucracy of going up the entire GE umbrella. And it allows us to make faster decisions, invest more money into research and development, and most importantly, invest more money into our people. So for the sake of time, this just goes back to the timeline of innovation dating back all the way for GE Healthcare specifically, but dating back to 1896 for the first X-ray ever invented. So just to get a little glimpse of how long GE Healthcare has been around. So our business is split into 4 core businesses, and the commercial leadership program that we're going to be recruiting for at U of A, you get a glimpse and experience in every single one of these businesses. But it's going to be imaging, MRI, CT, X-ray, every single type of ultrasound that you have, whether it's in outpatient clinics or at hospitals. Life Care Solutions, which is the business that I'm in, which is patient monitoring in your emergency departments, ICU, pre-op PACU, and then our service. We have an extremely great service team with field engineers who help keep our customers up and running, making sure that they can treat their patients. We partner with a lot of other large healthcare companies and integrate their technology into our products as well. So we're an industry leader in terms of having the best partners to make sure that if we're not the expert in one area, we're going to make sure that we include the expert from that area and integrate it into our devices. One of the best things that I absolutely love about GE Healthcare is the people. It was one of the biggest reasons that I wanted to join the commercial leadership program. I knew that the investment that they make in their people, and the people that you're surrounded by, creative, trusting, leading with transparency, diverse. So at GE Healthcare, the employee resource groups and forums, events, boards are endless. Veterans, you name it. There's weekly announcements, and whatever diversity inclusion is a huge factor for GE Healthcare. But what I really want to talk about today is what we're recruiting for at U of A. So the commercial leadership program, there are 2 opportunities. We have the full-time program and we have the commercial leadership program internship. Both are paid positions, but they're both designed to produce future leaders in the GE Healthcare portfolio. Now, it's the commercial leadership program, and commercial doesn't necessarily mean sales. It could be operations, it could be marketing, it could be product development. It really is truly a program that it is what you make it, and it's up to the individual to make it their own. But you get an extreme amount of exposure to product training, leadership, strategic planning, sales experience, and they're going to rotate you through every single phase of the GE Healthcare business so that you get experience in all those businesses I mentioned earlier: imaging, ultrasound, service, so that you can truly find out which business feels like home for you. And then from there, it's up to you to make your own journey and decide what you want to do with it. So that's what I loved about it. It wasn't a structured program, so to say. It really is what you make it. And because of the exposure and investment and leadership involvement that this program has, because they are expecting the individuals that go through it to be future leaders within GE Healthcare, they really allow you to make it what you can. But so for the full-time program that we'll be recruiting for at U of A, it is a 24-month program. consisting of 3 phases, and they are all in different geographic locations. So geographic mobility is a big component and requirement that we look for. So your first phase will be 6 months, and you'll be out in the field. It could be anywhere in the US, and you will be shadowing all of the GE healthcare team, learning about the different businesses, learning about hospitals, learning about health systems, just learning how the industry works. And then from there is where you go back to Milwaukee, Wisconsin, and you're going to go through your sales and product training and specific project work. And that's where you will be aligned to a specific business within GE Healthcare and really start to hone in and specialize in that area. And then the third phase, you will go back to the field-based setting, and you're going to apply everything that you learned during training and specializing in that business and working in the field in a small territory capacity with the end goal of taking on a full-time role, either that be a sales, service, product development, or operations role. And then the internship's a great pipeline into the full-time program. So the interns, it's a 10-week program, and most of the majority of the full-time CLP candidates actually come from the internship. So during those 10 weeks, you will be assigned a special project based on your interests, background, degree, and it'll usually be around a business challenge that GE Healthcare is experiencing, whether that be in the field with sales, operations, finance. It literally could be anything. And the internship is also a great opportunity to really make it your own. And it is what you make it, because based on your experience and what you're interested in, they will find a project for you to work on. Nothing's ever perfect, and there's always opportunities. And at the end of the internship, you get an opportunity to present to an executive board and your entire leadership team on the project work that you've done and the outcomes that it'll have. But again, the biggest thing is the internship is the pipeline, the main pipeline into the full-time program. So I kind of talked about these areas already, but really what we're looking for at U of A, and again, as I've said in the past, we have had success at U of A with some recent CLP candidates coming into the program, but you really need to be adaptable, willingness to learn. It's called the Commercial Leadership Program. So obviously leadership is going to be one of the top priorities, and also authentic leadership at that, and strong teamwork, cooperation, flexible, comfortable being uncomfortable, self-starter mindset. And this isn't, like I said, this isn't just a sales program. We are open to all majors, any experience. We have a lot of individuals who come into it who are at the MBA level, and it's it really the biggest thing is just, do you have that it factor and that self-starter and make it what you want? Because it is slightly a little bit unstructured. So you have to really make it your own. But this will be our process for the U of A career fair. So the job postings will be posted on Handshake for both the internship and the development programs, but the individuals are actually going to have to apply externally. So I will send out the links to this entire team as well for the external job postings, but they will be posted in Handshake as well. But the biggest thing I can tell you is, if you think you have students that you work with that would be interested in a program like this, please let them know to apply even before the career fair that will be at next Thursday on September 15th. Let them know to apply before, and let them know to stop by our booth. Myself and then 3 other individuals will be there. And we're happy to be back at U of A, and we would love the opportunity to pass on more candidates for both the internship and the full-time CLP program.